Have you ever noticed a bit of pink in the sink after brushing your teeth? Or maybe your gums bleed when you floss? It can be a little alarming, and if it happens often, you might start to worry. But what does it really mean when your gums bleed? Let's dive into it. First off, it's important to understand that bleeding gums aren't a disease themselves, but rather a sign that something else is going on in your body. Think of it like a warning light on your car's dashboard. It could be something simple, or it could be pointing to a more serious issue that needs attention. So, if this is a persistent problem for you, it's always a good idea to chat with a doctor or dentist. So, what are the usual suspects behind bleeding gums? The most common cause is poor oral hygiene. When you don't brush and floss regularly, a sticky film of bacteria called plaque builds up along your gum line. This can lead to gingivitis, which is the earliest stage of gum disease. Your gums might become red, swollen, and yes, they'll bleed easily. Other lifestyle habits, like smoking, can also make you more prone to gum problems. Sometimes the cause isn't just in your mouth. Your whole body is connected after all. Hormonal changes, like those during puberty, pregnancy, or menopause, can make your gums more sensitive and likely to bleed. Deficiencies in certain vitamins, especially vitamin C and vitamin K, can also be a factor. Even stress can take a toll on your oral health. In some cases, bleeding gums can be a symptom of underlying health conditions like diabetes, blood clotting disorders, or even leukemia. This is why it's so crucial not to ignore persistent bleeding. Now for the good news. What can you do about it? Treatment really depends on the root cause. If it's a simple case of gingivitis, stepping up your oral hygiene game is key. Your dentist might recommend a professional deep cleaning, and in more advanced cases of gum disease, known as periodontitis, procedures like surgery or laser therapy might be needed to restore your gum health. If your dentist rules out gum disease, they'll work to figure out what else could be going on. They might suggest blood tests to check for vitamin deficiencies, diabetes, or other health issues. It's all about finding that underlying cause and treating it directly. But what can you do at home? Right now, start with the basics. Brush your teeth gently with a soft bristled toothbrush at least twice a day. Don't forget to floss daily. This is non-negotiable for cleaning between your teeth where your brush can't reach. Rinsing with warm salt water or an antibacterial mouthwash can also help reduce bacteria and soothe inflammation. And if you smoke, finding support to quit is one of the best things you can do for your gums and your overall health. You might be wondering, what's the big deal if I just ignore it? Well, untreated gum problems can get much worse. The inflammation can eventually damage the tissues and bone that hold your teeth in place. This can lead to serious infections, persistent bad breath, and ultimately, tooth loss. That's a pretty high price to pay for something that's often preventable. So, when should you make that appointment? While a little bleeding now and then might not be a major concern, if your gums are bleeding regularly for more than a week or two, it's time to see a professional. They can give you a proper diagnosis and get you on the right track to a healthy, happy smile. Healthy gums should be firm, pink, and they shouldn't bleed when you brush or floss. Don't settle for anything less. Thanks for tuning in today. I hope this helps you understand your oral health a little better. If you found this video helpful, please give it a thumbs up and subscribe for more health and wellness tips. Stay healthy and keep smiling.